Good morning, everyone. I think we're going to go ahead and get started. Thank you for joining us on this rainy morning, at least here in Pittsburgh. It's really a stormy day, so it's a nice day to have a webinar and not have to go out into this rain to listen to this really important topic. We are so pleased this morning to have Janice Meinert from Pennsylvania Health Law Project do this presentation today on understanding Medicaid home and community-based waivers for people with disabilities. So at this point, I'd like to introduce Janice and thank her again for joining us this morning. Janice?
Thank you. Good morning, everybody. Thanks so much for joining us this morning. As Patty said, this webinar is a project that's funded by the Pennsylvania Developmental Disabilities Council. So we're going to talk today about Pennsylvania's Medicaid home and community-based services, often referred to as waiver programs. But I want to start just by giving you some information about the organization I work for folks who may not be familiar with us and not know that we can be a resource to people. So the Health Law Project is a statewide nonprofit law firm, and our work focuses on helping people understand public health insurance programs, understand eligibility for those programs, and how to access services through publicly funded healthcare. And so when we're talking about publicly funded healthcare programs, we're primarily talking about Medicaid, or what we call medical assistance in Pennsylvania. You may hear me refer to them, refer to Medicaid or medical assistance, talking about the same thing. CHIP, the Children's Health Insurance Program, is a publicly funded healthcare, coverage, and to a lesser extent, but primarily for people who are low income, we also help people with Medicare, understanding the different parts of Medicare, and in particular, understanding how Medicare and Medicaid work together, because people can be eligible and have both of those insurances. So the primary way that people get to us is through our helpline. You see the number on your screen there. And our helpline is open on Mondays and Wednesdays. Generally, you don't get to one of our intake folks live. You call, you leave a message, and then from the early part of the day, our fabulous intake team starts to pull those messages and return those phone calls. So anybody can call the helpline. So you can be calling the helpline on behalf of yourself, a family member, social workers call our helpline, providers, anybody can call the helpline. Our services are free, and we don't have any, income limits in terms of, who we can help. So when people get to us, we can be providing, legal advice to them. As I said, information on Medicaid, eligibility, access to services. We help people with service denials with Medicaid, and in those cases can provide advice. And we can also provide legal representation with Medicaid service denials. Those are typically grievances with the Medicaid managed care plans. We can also represent people in fair hearings. That's another level of appeal that people on Medicaid have a right to. And then in addition to our direct service work, and from the direct service work, we also do a lot of policy advocacy, primarily at the state level with the various state offices that are responsible for the Medicaid program, the Office of Medical Assistance Programs, the Office of Mental Health and Substance Abuse Services, the Office of Income Maintenance that's responsible for Medicaid eligibility. So we do a lot of policy advocacy that's really driven a lot by those calls to our helpline. People call us, they raise issues. Those issues then could be potential systemic issues. And then that's where we work with the appropriate state officials to try to troubleshoot problems and improve the system overall. And then the third piece of our work is, partly what we're doing this morning, just community education, webinars, in-person trainings. We create a lot of fact sheets, some manuals that are 20 or 30 pages long, all of which you'll find on our website, phlp.org. And we also do provide an e-newsletter monthly. If folks are interested in getting that newsletter and don't right now, feel free just to email me. My email's on that first slide, jminard@phlp.org, and I'll be glad to forward that to the appropriate person at the Health Law Project to make sure your name and email gets added to that list. So just a couple of, some of which I've already highlighted. When might somebody want to call us at the Health Law Project? As I said, both on the eligibility side of Medicaid and CHIP, and on the access to services side. So people calling us around Medicaid eligibility, around Medicaid waiver eligibility, loss of Medicaid or the waivers. So people should receive notices. They're entitled to an advance notice. And people can call us to say, their Medicaid's been terminated or they've lost eligibility for one of the Medicaid waiver programs, don't know why, and need help troubleshooting that. Helping people understand how Medicare and Medicaid work together. Not unusual for, an individual to have Medicaid and then get Medicare, or vice versa. They're two different insurance programs, each complicated in and of itself. And so people often can be really confused about how to navigate those two insurances together. That's a part of our expertise and what we can help people understand. And then helping people understand how to access care with Medicaid. And as I said earlier, we also assist people with denials of Medicaid services or reductions of Medicaid services. We do not assist people with Medicare service denials, only with Medicaid service denials. And also assist people on certain waivers, not all the waivers, but on certain waivers. Also help people with certain Medicaid waiver service denials. And we'll talk a little bit more about that, today as we get into talking about the waiver programs. So, when in doubt, if it's Medicaid related, Medicaid waivers, Medicaid and Medicare, or just Medicare eligibility, those are all the things that are our expertise, and please reach out to us for help. So we're going to talk today about Medicaid home and community-based services, sometimes seen and written as just HCBS, and also known frequently as waiver or waiver programs, and referred to as waiver programs because in order for any state to set up a particular waiver program for a specific population of people, and that's how all waiver programs work, the state Medicaid program needs to develop the waiver and the services that will be a part of that waiver, and then needs to submit that to the federal government, specifically the Center for Medicare and Medicaid Services, and the Center for Medicare and Medicaid Services, or CMS, needs to approve any state's waiver programs, because generally what laws we're asking the federal government to waive are the laws that say, Medicaid only covers, this service and this service and this service. And so in order for a Medicaid waiver to cover things above and beyond what Medicaid covers, or above and beyond what Medicaid may cover for an adult defined as 21 or older, we need the federal government's permission to operate that waiver program. The point of all of Medicaid waiver programs is to provide in-home or in-community services, so that people don't need to live somewhere outside of their home, and don't need to live in an institution like a nursing home. So that's the overall point of waiver programs, to provide people the services and supports, equipment, home modifications, lots of things that could be included in any particular waiver. And we'll talk more about that in detail, so that somebody can remain at home or continue to live in their community and avoid institutional care, which generally most people want to avoid. They don't want to be in a institution setting or congregate setting in a nursing home. So waiver programs can provide both medical services and non-medical services to assist people to live in their home. And as I said, can pay for items and services that are otherwise not covered by people with, Medicaid insurance. Each of Pennsylvania Medicaid programs have, a variety of services, some of which overlap from one Medicaid waiver program to a next, some that are, specific to that, individual waiver. And again, we're going to get into, more detail about that. When somebody is approved for a Pennsylvania Medicaid waiver program, if they don't already have Medicaid insurance, they also get Medicaid health insurance. So those two things always go hand in hand. So some people are applying for one of Pennsylvania waiver programs and already have Medicaid in some other category. Everybody has Medicaid in a category of eligibility. So people can already have Medicaid when they apply for one of the waiver programs. That's fine. Some people apply for waivers who aren't otherwise eligible, financially eligible for Medicaid insurance. But getting approved for one of the Medicaid waiver programs then automatically also gives somebody Medicaid insurance. And people have to be both clinically eligible for a waiver and financially eligible for a waiver. And we're going to talk more about that.
Janice, there are a couple of questions regarding the services that the Health Law Project provides. One person asked if you can help with I think it's the supplements, the money that's being taken out of Social Security benefits supposed to be covered due to Medicare and Medicaid dual qualifications. So if someone is not getting those supplements, I think that's the question. Can you help with that?
Okay, yes, I think if the person is asking about help with the Medicare Part B premium that Medicaid can pay for, yes, we absolutely can help people with that, because that's a separate Medicaid benefit, and all people on Medicaid with Medicare don't automatically qualify for the state to pay their Medicare Part B premium. That premium this year for most people is $174.70 a month. So for lots of folks, generally, certainly for low income people, that's a big chunk of money. And when people are eligible for Medicaid to pay that Medicare Part B premium, it's a huge help to people. And yes, absolutely, we understand that program and can assist people who are eligible. We can screen them for eligibility, help them understand, if they're eligible or not, and what they even may be able to do to become eligible. Maybe somebody has an extra, $500 that puts them over the resource limit, but, also has a credit card debt of $1,000. So maybe they pay that down. But yes, we absolutely can assist people with that. As I said, as well as, people who have both Medicare and Medicaid and, maybe unsure about, all the benefits that they should have with both of those insurances, or what Medicare should be covering versus what Medicaid should pay for. Those are all things we can assist people with.
And there was one other question about can the law project help waiver recipients get same-day rides with non-medical transportation?
It depends on the waiver program. We currently only have funding to assist people, and we're going to talk through all these waivers, to assist people with the Community Health Choices waiver and the OBRA waiver. So if somebody is currently on one of those two waivers and are having problems getting transportation, non-medical transportation, or medical transportation, one is a waiver service, one is a Medicaid service, that is something we can help people with.
Thank you. Okay, I think that's it for the moment.
Okay, great. Thank you.
Mhm.
Okay, so just to talk a bit about, why waiver programs are important. I think very helpful for people to know about. Certainly families of kids that have various disabilities or health conditions that are perhaps unlikely to change significantly over time, or a diagnosis that such as cerebral palsy that short of a cure isn't going to change over time. I think it's really helpful for people to understand what are these waiver programs, but why might I be paying attention to them and understanding them and knowing the various criteria for each of the waiver, especially as kids age. Medicaid insurance is very good, very comprehensive insurance. Medicaid for kids is even better, even more comprehensive than all the benefits adults get on Medicaid. And adults, for the purposes of Medicaid services, not eligibility, but Medicaid services, adults are defined by the federal Medicaid program as 21 and older. Kids on Medicaid and tied to a federal Medicaid law, EPSDT, early periodic screening, diagnosis, and treatment, in a nutshell, is a federal Medicaid law that says kids eligible for Medicaid on Medicaid get all medically necessary services. And so that leads to a very broad package of both physical health and behavioral health services that kids can get, again, kids up to age 21 on Medicaid. And then there are several services that end when kids turn 21, like, in-home nursing services, ongoing in-home nursing services, in-home home health aid services. There are behavioral health services for kids that end when they turn 21. IBHS services, with those familiar, it used to be BHRS, sometimes referred to as wraparound. Those services transition to a new service, intensive behavioral health services, IBHS. Those services end when kids turn 21. There are educational laws that say kids with disabilities can remain in school. If I'm correct on this, that used to be age 21. I think Pennsylvania just bumped that to age 22. So there are services and supports kids are getting in school, through school, that end when they hit 21 or 22, if they're still in school up till that age. So waiver programs can provide services, some of which might, mimic or look like some of the services kids received, up until their age 21. So the waiver programs can really help, fill in the gap and provide not only some of the services kids on Medicaid may lose when they turn 21, but also other services and supports for kids 21 and older, who have now not only aged out of some of those Medicaid services, even if they remain on Medicaid and eligible, they're also aging out of their rights to education. So, that's one, really important reason to know about these waiver programs. And then just generally as we age, as we become perhaps more infirm, more physically disabled, there are waiver programs that can help us have our needs met so that we can stay at home. So Pennsylvania currently has 6 waiver programs. 3 of those waiver programs are for people with an ID, an intellectual disability diagnosis, and or an autism diagnosis. We have 1 waiver program for adults with autism who also need to meet other clinical criteria, and same as the ID waiver. We're going to talk more about each of these. We have 1 waiver program for adults with physical disabilities. That's the Community Health Choices waiver, or often just referred to as CHC. And we have 1 waiver program for adults with developmental physical disabilities. Adult in this case defined at age 18 and older. And that's the OBRA waiver. So the 3 Pennsylvania ID waivers that we currently have, the PFDS waiver, Person Family Directed Support is what PFDS stands for. There's the Community Living waiver and the Consolidated Waiver. Again, in terms of clinical criteria, and we'll talk later about the financial eligibility as well. But clinical criteria for these 3 waivers, the individual has to have, and it can be, determined at any age, including, an early age, 2 or 3 years old, a diagnosis of an intellectual disability, or a diagnosis of autism. In some cases, individuals could have both of those, but only need to have one or the other. Or a child with a developmental disability who is under the age of 9, but there is clinical documentation to support that that child has a high probability of ending up with, and may not yet have, but ending up with an ID or an autism diagnosis. Or, and some of these can be or children under 22 with a developmental disability, due to a medically complex condition. And then there's additional clinical criteria for all of these 3 ID waiver programs. That the person with the intellectual disability does need to have a full-scale IQ of 70 or below. Sometimes there's variance to that, but generally counties in particular still seem to really latch on to, and the below the 70 or below IQ, or have an autism diagnosis. And an autism diagnosis, and many folks I'm sure on this webinar know, that having an autism diagnosis doesn't mean you also have, a low IQ or, an intellectual disability diagnosis at all. And again, as I said, or developmental disability with a high likelihood, as shown by evaluations, medical records, that this child has a high likelihood of having an ID or an autism diagnosis, or a developmental disability due to a medically complex condition that needs to have been diagnosed before the age of 22. And, so that, that's an important piece, because sometimes people may have a developmental disability that may not have been diagnosed early. And that seems to be more prevalent in folks my age, in their 50s or 60s and beyond. And then in addition to meeting, one of, the other clinical criteria that's required, then the individual also has to have substantial adaptive skill deficits, and there is obviously some subjectivity in the word substantial adaptive skill deficits, in at least 3 or more of the following life activities: self-care, understanding and use of language, learning, mobility, self-direction, capacity for independent living. And so there are, assessment tools, along with things like medical records, evaluations, psychological evaluations, neurological evaluations. There could be various medical documentation, that also could support, whether or not, or speak to whether or not the individual trying to, or applying for one of the 3 intellectual disability waivers, it has those substantial adaptive skill deficits in 3 or more of those listed areas of life activities. And lastly, and a clinical criteria for these 3 ID waivers is that the individual has to be recommended for an intermediate level of care for an or other related condition by a medical evaluation. So this is the one of the clinical criteria piece that's required, not because somebody is going to then receive through the waiver an intermediate level of care that is typically an institutional level of care. It is so that person has the need, but then in order to keep them out, potentially, out of, a nursing home or a state institution, they receive the waiver and the appropriate waiver services that individual needs to support them to live, in the community, maybe in their own home, maybe in somebody else's home. But it's the level of clinical criteria needed in order for somebody to be eligible for any one of the 3 ID waivers. So 3 different ID waivers, all with the exact same set of clinical criteria that needs to be met before somebody could be enrolled in one of the 3 ID waivers.
Janice, there's a question regarding, someone asks about what happens if an individual with physical and intellectual disabilities ages out of EPSDT Medicaid but does not yet have a waiver.
Yeah, it's a really good question, and one that I've thought a lot about while putting together the presentation. And we can maybe talk even more about this, just trying to, be respectful of time and everybody's questions. But I think the short answer is there isn't always, I think, a clear answer to, well, if I'm eligible for an intellectual disability waiver, but also physically may be eligible for one of the other 2 waivers we'll talk about, the OBRA waiver or the CHC, the Community Health Choices waiver, which is the better waiver. There is no better waiver. So it really comes down to helping the individual and their family, whoever is supporting them, understand, that the differences in, between the waivers, understand the different services covered by one waiver versus another, and understanding who are the providers of the services in those, say, looking at 2 different waivers. And so I think sometimes that really can kind of get into the weeds. And then the other really important factor, and again, we'll talk more about this, is some of Pennsylvania waivers, two of the six, do not have waiting lists. And if you're clinically and financially eligible, it's an entitlement, the way Medicaid is an entitlement. Clinically eligible, financially eligible, you get to be enrolled in that waiver. The four other waivers all have waiting lists. So that becomes, of course, a factor for somebody. And maybe the waiver you can get in now, if you had a choice of, an ID waiver and a CHC waiver, and look at all those things I talked about exploring, maybe the ID waiver feels like the better fit for this person. But that waiver's got a waiting list and the CHC waiver doesn't. So it's a great question. And unfortunately, I think not necessarily an easy answer. We certainly can help people to some extent explore those. But I do think the other challenge is, I think the people in the ID, that are responsible for the ID waiver know the ID waiver. And, that's a whole different state and county department than the folks that manage the CHC waiver. So I think we probably still have a way to go in helping people, kind of understand this whole picture in order to better answer that really important question for many individuals.
Janice, that there was a question about which two waivers do not have a waiting list.
It's the OBRA waiver and the CHC or Community Health Choices waiver. And we're going to get into, I'm going to talk about that as we move on.
Okay.
So 3 ID waivers, as I mentioned earlier: PFDS, Person Family Directed Supports, Community Living Waiver, Consolidated Waiver. As I said on the previous slides, clinical criteria is all the same. Same as the financial criteria that we're going to talk about later. The PFDS waiver has an annual or a fiscal, not necessarily a calendar year, but 12 months nonetheless, a fiscal year cap of $41,000. So it's $41,000 worth of services in that given 12 months. And then it resets again, going into the next year. The Community Living Waiver has a spending cap on services at $85,000 a year. The Consolidated Waiver has no spending cap. So as folks could imagine who, need one of the ID waivers, the Consolidated Waiver is certainly the most coveted, all of which are hard to get into, unfortunately. So most of the ID waivers, the 3 ID waivers, have very similar services. If you just Google, Consolidated Waiver, it's likely going to take you pretty quickly to, the Department of Human Services website that's going to give you a brief overview on the Consolidated Waiver. It's right on that first page. It's going to list all of the services that are a part of the waiver. And then there'll actually be a link to the waiver document itself, which is hundreds of pages long. But, being able to do like a quick word search sometimes, gets you into the weeds of, just, what employment services, well, what does that mean? What is that exactly? What might somebody on one of the 3 ID waivers get, in the way of employment services? But these 3 ID waivers share a lot of the same services. And everybody in an intellectual disability waiver has a supports coordinator. In other waivers, it's called a service coordinator, but in the ID waivers, it's referred to as a supports coordinator. That's the individual who's responsible for, everything from helping people get into one of the ID waivers and actually advocating for their individual clients, to get into the ID waiver because, again, unfortunately, there are waiting lists. They, are responsible for helping people, understand all of the services available, help them, and on the ID side, are responsible for helping them understand, if there's an opening for the PFDS waiver, will that meet my needs or my family members' needs? Those are the kinds of things supports coordinators are trained and educated in and can help people, understand each of the waivers, each of their services, many of which, as I said, overlap, and what some of the costs might be associated to the services. So, $41,000 a year doesn't really mean much probably to most of us in terms of what does that buy me? What does that buy, my family member who's on or trying to get into one of these ID waiver services? And then that supports coordinator is responsible for working with the individual and any and everybody else the individual identifies as, kind of part of their team, their support system, in developing their what's called an ISP, an individual support plan, that then gets into the details of, what services do I want or need? What are the things I'm interested in? Do I want to work? Do I want to volunteer? Are there services within that waiver that will support me and help me to figure out if I want to work and figure out what kind of work and connect me to perhaps employers? So, that's where person by person, it should be very individualized. What are my wants and needs? What are my goals for myself? What, where perhaps even do I see myself? I'm 25. Where do I maybe see myself or want for myself? If I'm able, to articulate those things, in 3 years or in 5 years, and what within the waiver can perhaps help me get there. So as I said, this is not, a comprehensive list of all of the services covered under each of the ID waivers. And as I said, they overlap a lot between the 3 ID waivers, but they're, it's not identical. Each of those 3 ID waivers do not cover all of the exact same services. Of, I think, a particular note is that the PFDS waiver and the community living waiver, so 2 of the 3 ID waivers do not provide the service that's referred to as residential habilitation, what folks might often refer to as a group home. Even when there are people who are, in the consolidated waiver that are in a kind of quote unquote group home where they may live by themselves. There may not be anybody else in that, quote unquote group home. So it is only the consolidated waiver that provides residential habilitation, which, makes sense because most of us could imagine that's a very expensive and intensive level of services. And so it makes sense that there's a cap on the PFDS waiver, a cap on the community living waiver, and those caps would not support somebody living in a residential habilitation, in a group home, so to speak. So it's only the consolidated waiver that provides that particular service, and just one that I wanted to make a point to highlight without getting into every waiver service in each of these 3 ID waivers.
Janice, there's a question about if a person was on CHC or OBRA waiver at age 18, would they be able to switch to an ID waiver later?
So the CHC waiver doesn't begin till 21, but let's say then the OBRA waiver does begin at age 18. Could they switch to one of the ID waivers? Yes. There's nothing in the rules or the laws that prevent that when somebody perhaps, realizes that, this CHC waiver perhaps is really not the one best suited for me or for my family member. After, learning or knowing or understanding more about one of the 3 ID waivers, it's perhaps one of those. The challenge is the waiting list, and somebody who's, and we'll talk more a bit about how the waiting list on the ID waiver side works, that it's going to be harder for, generally speaking, for somebody who's currently, say, 22 and in the OBRA waiver or in the CHC waiver, wanting to transition into one of the 3 ID waivers. In particular, if it's the consolidated waiver, that is what's really best, ideally, the one they would choose for themselves. Because of how those waiting lists work, because of what factors go into determining where somebody is on the waiting list, because the waiting list is not just a first come, first serve. So somebody who's already getting services through CHC or OBRA waiver is generally far less likely to get to the top of an ID waiting list. That's a general, I think, accurate statement, but general, and should in no way discourage people from, pushing for getting into for themselves or their family member the waiver that really is best suited to meet their needs.
There is a question about accommodations, reasonable accommodations within HUD or subsidized housing. I think the question is, does the waiver, let's see, are there scenarios of times when the waiver does not take care of certain accommodations for participants in subsidized housing?
It would depend on the waiver, and if I'm understanding the question correctly, Maria, when they say accommodations, I'm imagining the person's talking about like a physical accommodation, like a ramp to get into their home, or a stair glide to be able to go, up and down steps inside their home. That would be dependent on the waiver and what services that the waiver provides. And I am the furthest thing from an expert on public housing rules and laws. But it would, I think, certainly be tied to, what accommodations can be made in public or subsidized housing, and what accommodations might be the responsibility of the housing authority, and kind of who pays first.
Yep.
So yes, the waiver could provide accommodations, but I think that scenario could get into the details of who's supposed to be paying, and what permissions might be needed from perhaps housing authority, the county, perhaps housing authority, to make an accommodation into a housing unit, and what is that accommodation might also play into it.
Thank you.
Sure. So how do folks apply for the ID waivers? The 3 ID waivers are ultimately responsible of the state Office of Developmental Programs, but the waivers are managed at the county level. And by county, I mean, the county intellectual disability offices. And in each county, counties go by different names. Some counties say, this is the county office of intellectual disabilities. Some might call themselves the county of, developmental disabilities. I think Armstrong, Indiana is behavioral health and developmental disabilities. I might have even got that wrong. But generally, just, if you're not familiar, and you just Google, Dauphin County Office of Intellectual Disability, you're gonna get there. You're likely gonna get there. And the state website may also direct you to, okay, where is this, county office? That the county offices are often also referred to as the administrative entity, or you'll see, because the state and county systems love the acronyms. The AE, somebody's referring to the AE. It's the county ID office at the administrative entity. They are generally the same thing. So it's at the county office that the application process begins with, as I said, ultimate oversight of the rules and the finances for the 3 ID waivers. Is the responsibility of the state Office of Developmental Programs. So it's the county or the administrative entity excuse me, that's, responsible for that level of care determination. And the administrative entities, across the state, county by county, all use, the common tools to assess people's eligibility. And then from there, if deemed eligible, to determine, where that person is on the waiting list, and how they prioritize. And that, of course, can change with people's circumstances. So it's, really important for people who are already connected to the ID waivers, perhaps even have a supports coordinator already, even though they're not in one of the 3 ID waivers, that they're in communication with that supports coordinator when there might be changes for that individual, changes in their supports, changes in where they're living or where they can no longer live, the kinds of things that, really could impact, where somebody is on that waiting list, and may result in needing, that PUNS, prioritization of urgency of need for services is the tool, is what PUNS refers to. And so somebody may, have to have, their PUNS tool, redone, because they're on an ID waiting list, they're living at home with a parent primarily as their caretaker, and that parent becomes very sick and is no longer able to provide what might be a whole lot of supports to that individual, who perhaps can't, and likely, not likely, but perhaps cannot live on their own, need lots of perhaps day-to-day care. And now that primary caregiver for this individual waiting for one of the 3 ID waivers can no longer be the primary caregiver. That changes that person's circumstances substantially. And that's when you want to be talking to the supports coordinator and asking that, that a new PUNS be done, a new assessment. We need to, re-examine where this individual is, on the waiting list, especially if they're not already in, the emergency needs category, because the waiting list is carved out by, 3 categories: emergency needs, which is kind of a disservice to people on the emergency list because they can be on that list for literally years. The critical needs category, or the planning needs category. So, perhaps a 9-year-old with an autism diagnosis, perhaps also an intellectual disability diagnosis. They may be on the waiting list, in that planning needs category, meaning that it's, likely 2 years or more before they're actually going to need the services that are a part of the ID waiver. Currently, right now, there are over 13,000 people total on the ID waiting list in either the emergency category, the critical needs category, or the planning needs category. There is actually a website that has been active for quite a number of years the PA waiting list campaign, where people can go on there and see exactly, how many people in each category. And I also wanted to mention that, and some of us, of course, follow this closer than others. Every year, the Pennsylvania budget is proposed either February, early March by the current governor. The governor proposes the budget for the next fiscal year, in this case, looking at the 24-25 fiscal year that will begin July 1 of this year through June 30th of next year. So the budget and what gets funded in a given fiscal year in Pennsylvania starts with what the governor proposes and the areas that the governor, hopefully with lots of input, including from all of us, about what are priority needs for Pennsylvanians, lays that budget out, very line by line detail for the legislature. And then the legislature does their work around looking at what's the governor requesting, what's it costing, where's that putting the state of finances for Pennsylvania, and then goes back to the governor, hopefully before June 30th, with what they're agreeing to or not agreeing to. And so I share that because this year the governor's budget includes increased funding for the intellectual disability waivers, such that it could remove 1,000 or more people from the waiting list and be providing service to these folks, potentially as soon as July of this year. So if this waiting list is a concern for you generally or personally, this is a really key time. It's the beginning of April. There is certainly no budget finalized by any stretch, and hopefully all the players do their jobs as they should, and there will be a signed budget by the governor by June 30th. This is a really key time to reach out to your state senators, your state reps, certainly the governor's office, but key right now in the moment are your state senators and your state reps, to share with them if this is important to you, generally or personally, and certainly if it's important to you personally, to visit your legislators, to call or email your legislators, to do all of the above and let them know what this means for you or for your, somebody you care for or care about, if the budget gets passed, and why there's a need for more, because the governor's proposed budget is, not proposing to fund these 3 waivers such that the possibility would be in July, there's no longer a waiting list. That's not proposed and likely financially highly improbable to happen. But again, our legislators need to hear from us about, what matters to us and to our lives and to our families' lives. This is a really important time to do that for people inclined and wanting to do that.
Janice, a couple of questions. If you do not have someone asked, if we do not have a waiver request prior to age 21, are we still able to apply after age 21?
Yes. I mean, absolutely. The criteria, the criteria that for the 3 ID waivers, needs to be met, as well as the financial criteria. But, yes, absolutely. I think, ideally people learn about these, in particular, the 3 ID waivers, before, they or their family member turns 21, because depending on the circumstances for that, soon to be or now 21-year-old, their life can really change significantly. If they're getting lots of supports, including social interactions in a school setting, they may be getting other in-home supports, physical health and or behavioral health, and perhaps all of those could be ending when that person turns 21. So the earlier folks get connected, in particular to these 3 ID waivers, and because of the long waiting list, the better. But yes, absolutely. A 40-year-old could be applying for an ID waiver. There's going to need to be the clinical documentation supporting diagnoses, and meeting then, of course, the other criteria.
Someone also asked if the consolidated waiver does cover the individual going on a trip.
I think it may depend on, the ID waiver isn't going to pay for the trip, questioning myself, but I would say no. There's nothing, I think, in the ID waiver that's likely going to pay for the trip. But I think the ID waiver could pay for some level of support that might be needed for, somebody to take a trip. Yeah. Yeah, like an individual that's supporting them.
And there is a question about my son's on the adult autism waiver. His coordinator told us that he would have to come off of those services to go on the consolidated waiver list. Is that true?
I'm not certain. I think no. If we have somebody in particular from the State Office of Developmental Programs on the call that wants to put that in the chat, that would be much appreciated. Or folks from the county ID program that are certain about that answer. I mean, in my thinking is it would not be the autism waiver. I don't think that even controls whether or not that's the case. I would be asking the county ID folks, is there a reason why I can't be on the waiting list for an ID waiver while I'm on the autism waiver? But just like the example I gave earlier, where somebody trying to choose between perhaps the CHC waiver and an ID waiver, the likelihood, because of the very large waiting lists for the ID waiver, the likelihood of somebody on an autism waiver, just like on the CHC waiver, of getting into perhaps the consolidated waiver on the ID side is likely going to be much more challenging, because some or many of their needs are already being met by the services and supports through the autism waiver. That's likely going to have them very low on the waiting list. If somebody knows the answer to that question, for sure, I'd really appreciate it. Otherwise, the person who asked, please feel free to email me, and I'm going to find that out for you. My email again, jminard@phlp.org, on the first slide.
There's a clarification that this person wrote about. He could go on the PUNS for a consolidated waiver, but would have to come off the autism waiver if a consolidated waiver became available, because you cannot be on 2 waivers at once. It is true that because he already has a waiver, his need would not be as high as someone who does not have a current waiver. So I think that's an answer.
Okay. Yes, and absolutely, you cannot be in more than 1 waiver program in Pennsylvania at the same time.
And again, just one last question that related to, there's someone asked about what are critical needs on the PUNS. I guess asking for a greater definition of that.
Critical emergency needs, again, I'm an advocate of changing the titles of these categories, just because I find them offensive, and I don't have a loved one on a waiting list. Emergency means what it's supposed to mean, that in this context, that somebody needs the, the services that are part of one of these ID waivers now. But that doesn't mean somebody, again, people wait years in the emergency category. So the critical needs, I should have the definition of this at my fingertips, and I don't. The critical need is just, it's kind of a level below the emergency need. So it's high up there, and there are things happening, in this individual's life and in their support system or lack thereof, that makes them a high priority to get the services of one of the three waivers. But as a result of the PUNS and assessment tool, the critical needs person hasn't risen to the level as high as the emergency needs. And again, if somebody has a clear answer for that, please feel free to put that in the chat.
And one last question related to the ID waiver. We do have some questions, by the way, on the CHC, but I'm sort of holding those because I know you'll be covering some of that information. But the last one on the ID is some individuals have waiver prior to the age of 21 while they're still in school. A majority of individuals receive guidance that the PUNS will guide the need after graduation. Why the discrepancy?
I'm not sure, Maria, if the question is the discrepancy between.
I think some people are already getting the waiver while they're in school, but then it says a majority of individuals are told that once they are after graduation, that the PUNS, they should get on the PUNS, I guess, to get consideration for waiver. And why is there a discrepancy?
Yeah, I mean, the waivers are, the three ID waivers, are available to people, who meet the clinical criteria, prior to the age of 21. So people can and do access them before the age of 21. I think some of this is because I think the waiting lists have such an effect on how this system works and how people who are a part of the system, even talk about, the waivers and the availability. And so, and I think quite honestly, some of that can even look different county to county. Some of that really can be because, one county has a far longer waiting list, perhaps just because of geography. It's Philadelphia, it's Allegheny, it's Erie. And so the waiting list could be so much longer that I think that the messaging perhaps coming, out of the county is, that your child's not, not going to get anywhere near a waiver before the age of 21. And that may be true. That may be how the reality plays out. But that should not stop people from, getting connected to the county ID system, having the PUNS done certainly earlier than age 21. Because again, depending on, this can definitely vary county to county. It does in terms of those waiting lists, which is why I personally am always surprised when I'm working with clients, working with families, working with kids that are 12 and on the PFDS waiver, because it does not seem to happen very often that people get into one of these three ID waivers prior to the age of 21. But people can, and also again, kind of tied to the, the PUNS and, and the needs. Medicaid has started to cover in Pennsylvania even some more services than they used to. Services people would have to, some home modifications that are adaptations that people used to have to be on a waiver to get, couldn't even get if you were under 21. So, some of it also gets down to what's the need? What is it that Medicaid insurance isn't currently covering for that 8 or 10 or 14-year-old that could only be covered, by the waiver service. And that certainly also plays into, why some youth before the age of 21 get into one of the ID waivers, and while others don't.
Great. And Patty is typing, someone did post the definitions for the emergency, critical, and planning need, the timeline. So Patty's posting that in the chat.
Yeah, I did want to mention if everyone could, look into the chat box, because I'm not sure if you guys can see the Q&A, but I am someone also included the puns form. I copied and pasted that into the chat box, as well as, some of the people that are answering some of the questions that Janice mentioned.
Thank you. Thank you
And
very much.
I thought someone did ask a good question about if you have the ID waiver, what happens if you move to a different, it says country, I don't know, or a different state, maybe county, different county, country?
I bet they meant county, Maria.
I think so. I think so. County or different state.
Yeah, if you move to a different state, you've lost the waiver, and you're starting at square one with whatever that state offers. And each state has different, certainly some similar waiver programs, but each state also has different waiver programs. So if somebody moves out of state that's currently in any Pennsylvania waiver, moving with the intent to move, not come back to Pennsylvania anytime soon, then yeah, no, people lose the waiver. It's a Pennsylvania, it's ruled and funded by both federal government and state government, but it's a Pennsylvania waiver that the individual has. So they lose it. If people are already enrolled in one of the ID waivers and they move from one county to another county, they do not lose their waiver. Their waiver goes with them. Their waiver service providers could certainly change, depending on what services that individual's receiving under their ID waiver. Their supports coordinator likely would change, maybe not necessarily, but likely, because they're now probably going to have a sports coordinator that's tied to their new county, but they do not lose their waiver.
Again, we're just Patty is providing information in the chat with some of the answers that are coming back. Someone answered about how Dauphin County and how the PUNS is operated in Dauphin County. Students sometimes receive waiver in school, but it's very rare from her experience working with the individuals with IDD and autism.
Thank you. I appreciate people helping me with answers I don't know and giving otherwise, hopefully valuable information. I appreciate that.
Okay.
So 6 waivers in Pennsylvania, 3 ID waivers, and now we're going to move on to the OBRA waiver. OBRA waiver is for individuals age 18 to 59. After 59, people, I think, remain in the OBRA waiver. They just can't get in the OBRA waiver after age 59. Some of the clinical criteria for the OBRA waiver: the person has a developmental disability, and that developmental disability occurred before the age of 22. That means there needs to be documentation of it, or maybe that individual's 25 and a clinician may be able to basically prove that, that the diagnoses, the developmental disability diagnoses, most definitely had to have occurred before the age of 22. But generally speaking, the documentation needs to be there, showing, even if I'm applying at the age of 50, showing that in fact I have a developmental disability and it occurred before the age of 22. And in many ways, that's, I think, the definition of a developmental disability. It's occurred early in our life. That disability is likely to continue indefinitely, and like the ID waivers, the other level of care criteria for the OBRA waiver is that somebody needs that intermediate care facility level of need. Again, with the point of the waiver, not so that somebody goes into, an institutional like setting, but to keep them, get them out of that level of care, or keep them from needing to go into that level of care, but need to meet that level as part of the criteria, the clinical criteria for the OBRA waiver. And like the ID waivers, the other piece of the clinical criteria is, not just that there's a developmental disability, that it occurred before the age of 22, but that disability, that developmental disability, results in, again, substantial functional limitations in at least 3 of the following, areas of self-care. The other thing regarding the OBRA waiver is that the individual's primary diagnosis cannot be an intellectual disability, and it cannot be a major mental illness, schizophrenia, major depression, bipolar disorder, lots of major mental illnesses. So it's possible the individual could have a diagnosis of ID, and or a major mental illness, but it cannot be what's considered in particular by treating clinicians as the person's primary diagnosis in order to also be clinically eligible for the OBRA waiver. Again, a very broad range of services. The ones listed there on the slide are not all encompassing. And again, a situation where if somebody might be clinically eligible for more than one waiver, where people probably really want to do some homework, hopefully with the help of others who know these waivers and details better, to try to figure out, if I'm clinically eligible and financially eligible for the OBRA waiver, is it the best fit for my needs? And certainly the services provided and the service providers currently contracted with the state to provide those services can be important in deciding is the OBRA waiver the one that's the best fit for me or my family member. So unlike the ID waivers that are managed at the county level, at the county ID offices, with oversight at the state level, the Office of Developmental Programs, the OBRA waiver, and this is also true of the CHC Community Health Choices waiver, this waiver is managed by the State Office of Long-Term Living. So individuals 18 and older who appear to meet the other clinical criteria apply for the OBRA waiver through the state's independent enrollment services. Currently, that contractor for the State Office of Long-Term Living that helps manage and kind of shepherd people through the OBRA waiver application is Maximus. Maximus is the name of the entity that currently has the contract with the State Office of Long-Term Living to help people with eligibility, enrollment, and kind of understanding that process for the OBRA waiver. People can start that application process by phone, and that's the number, or you can start that application process on the state's website, PAIEB, Pennsylvania Independent Enrollment Broker. And application for this waiver, in addition to a clinical assessment that will be done, the applicant's doctor has to complete a physician certification form. And on that physician certification form, in addition to listing the person's diagnoses, that must include a developmental disability diagnosis. That treating physician, generally a primary care doctor, has to indicate on that physician certification form that their patient, in their medical view, meets, the level of need for an intermediate care facility. Sometimes it's important for doctors who aren't familiar with the physician certification form to, help them understand why they're getting the form for their patient, and help them understand that, because sometimes doctors don't want to check that box, the box that says, and it's the same form for the OBRA waiver as it is for the CHC waiver, that physician certification form. I've talked to doctors who have said, well, I thought if I checked that box, that nursing facility clinically eligible box, or that intermediate care facility for other related condition box, it would mean my patient would then have to go into a nursing home or a facility. And that's not what my patient wants. So I deliberately didn't check that box. So doctors sometimes need help understanding, if you're trying to get into the OBRA waiver, explaining, to the physician, no, if you agree this is the level of need, it's not where I'm going or where my family member's going. It's to help keep them from going there. But they have to have that same level of need. So yes, I do need you to check that NFCE box or the ICF ORC box, because that is helping the person get the services, keeping them out of a facility, but giving them that similar or same level of care in the community. Oh, and very important note at the bottom that I failed to mention. There is no waiting list for the OBRA waiver, unlike the 3 ID waivers, and unfortunately, unlike the autism waiver. There is no waiting list for the OBRA waiver. So people are 18 or older, they meet the clinical criteria, they have a doctor complete and sign off on the level of need in the physician certification form. And they have an assessment, the clinical assessment, that again is the IE Independent Maximus is the entity that kind of shepherds people through that process. The clinical face-to-face assessment that's done for the OBRA waiver is called the FED, the Functional Eligibility Determination, is the tool, the assessment tool that's also a part of this. That people meet all the criteria as well as the financial, then they are in the OBRA waiver.
Janice, there's a question about, is there a funding cap for the OBRA waiver?
There is not. There is not. So it is tied to, and this is true, different mechanisms call them something different, like an individual support plan versus a person-centered service plan, what they call it on the CHC side. What services somebody gets then, is tied to, working with, in the OBRA waiver, it's a service coordinator, developing, their service plan, identifying wants and needs, hopefully being educated about the range of services available in any of these given waivers. And then in the case of the OBRA waiver, the requests for those services, maybe this many hours a week of hands-on personal assistant service support, whatever else somebody's requested. Then in the case of the OBRA waiver, it's the State Office of Long-Term Living who ultimately will approve the requested services or not. And when they're not approved as exactly as somebody requests them, then people have a right to an appeal. So tied to services available and need, there is no service dollar amount cap like we have on 2 of the 3 ID waivers.
Just a clarification, someone posted that an individual who turned 60 while in the waiver are able to continue to receive services through OBRA and that's from the DHS website. So people can continue on OBRA past age 60, according to this posting.
Okay, thank you. Yes, that was my understanding. You're just not you're not able to apply for it once you're 60 and older. But could certainly be eligible for another waiver, likely the CHC waiver. So the where are we? Fifth of the 6 waivers Pennsylvania has. The adult autism waiver. This waiver is called adult for a reason. An adult is defined in this case as somebody 21 and older. Clinical criteria: individual must have an autism diagnosis. They may also have an intellectual disability diagnosis or not, but key is that the person has, an autism diagnosis. Like the OBRA and 3 ID waivers, other part of the clinical criteria is the individual requiring the intermediate care facility level of need. And like the OBRA and ID waivers, being able to show there's substantial functional limitations in 3 or more of those same areas of living: self-care, receptive expressive language, learning, mobility, self-direction, and capacity for independent living. And again, like all of the waivers, autism waiver has its own set of services, the ones listed, and that's not the exclusive list. There are more services, and then service providers that are contracted with directly by the state, that provide services to people on the adult autism waiver. Application for the adult autism waiver, unlike the ID waivers and the OBRA waiver, is directly through the state, the Office of Developmental Programs, specifically the Bureau of Supports for Autism and Special Populations. That's a fairly new change in title, a couple years maybe. People can, make contact with the office prior to the person being age 21. They will not actually have an application process started before age 21, but they can, prior to age 21, 30 days prior, actually have, the application process started. But an individual can be placed on what is not called a waiting list for the adult autism waiver. It's referred to as the interest list. So people can make these connections. Family members for their individuals, can be calling and, getting more information, and prior to the age of 21. But the application process won't start for the autism waiver, unless it's within 30 days of the person's 21st birthday. And then the application doesn't mean, fortunately, that, somebody gets the adult autism waiver. Different than the 3 ID waivers that have emergency need category, critical need category, planning needs category. The interest list for individuals trying to get the autism waiver just goes by what they just call priority 1 or priority 2. So priority 1 is for individuals, not already receiving, home and community-based services. Priority 2 is for people who are receiving services, even if they're getting them in another, in another state or federally funded waiver, or in a nursing home, or in an intermediate care facility, or in a state center. So, for an example, somebody who's with an autism diagnosis, who's currently in one of the 3 ID waivers, they're 21 or older, they're currently in one of the 3 ID waivers, look into the autism waiver and its services and its service providers, and determine that the autism waiver seems like a better fit than one of the 3 ID waivers the person is on. They can still get on that interest list when they otherwise meet all the criteria for the adult autism waiver, but they're going to be in that priority 2 category. because they're already in another waiver program. And the current autism waiver is much, much smaller than any of the ID waivers in terms of capacity. Right now, I think there's a little over 700 people currently on the adult autism waiver. And then the last of the 6 waivers Pennsylvania has is the Community Health Choices waiver. And some folks might be, familiar with what were other waivers in Pennsylvania. The attendant care waiver, the independence waiver, the aging waiver, the home care waiver. I feel like I'm missing one. Those all used to be Pennsylvania waiver programs until the State Office of Long-Term Living created the Community Health Choices waiver. And people who were in, the OBRA waiver, that was the 5th one. People who were in any of those 5 waiver programs prior to the state creating and getting approval from the federal government for the Community Health Choices waiver, those folks were all then transferred to the Community Health Choices waiver, with the exception of some people in the OBRA waiver. And I should have mentioned this with the OBRA waiver because it's still the case now. When Community Health Choices was implemented, and it started in Southwest counties 2018, Southeast counties 2019, all the rest of the state in January 2020. Anybody who was already in attendant care, independence, home care, and aging waiver were transitioned into the Community Health Choices waiver, because those folks were all, basically the state merged all of those waivers into one waiver. With the exception of people who were on the OBRA waiver, people who, and this is true now as well, anybody in the OBRA waiver prior to the age of 21 will have a new assessment done when they're about to turn 21 to determine if, in addition to meeting clinical criteria for the OBRA waiver, if they also meet the clinical criteria for the CHC waiver. That clinical criteria is the person needs to be NFCE, nursing facility clinically eligible. So somebody prior to 21, because that OBRA waiver starts at 18. So folks between 18 and 21, as they get close to 21, who are assessed again, they were assessed to be determined eligible for OBRA, they get assessed again. If they meet the NFCE criteria, they get transitioned into the Community Health Choices waiver. So the CHC waiver is for people with physical disabilities, certainly may have other disabilities as well, but have physical disabilities such that they meet the nursing facility clinically eligible standard, that level of need the level of care in a nursing home. But again, the point being, helping people get out of nursing homes when they don't want to be there, or help people from going into a nursing home in the first place, because they want to be in the home, in their home and in the community. Clinical assessment, 2 pieces to the clinical assessment for the CHC waiver. The assessment tool that is done face-to-face in the person's home is also the FED, just like with the OBRA waiver, functional eligibility determination tool, and also requires that same physician certification form being completed by the applicant's doctor. And again, in this case, the doctor indicating the person believing in their medical opinion, their patient is nursing facility clinically eligible, needs that level of care without getting the right supports and services at home, would have to be in a nursing home. And that need is such that it's expected to be 12 months or longer. And just like with the OBRA waiver, sometimes doctors may need help understanding that form because they could hesitate to check that NFCE box and need being 12 months or older for fear their patient's going to be put in a nursing home. That's not the point of, this waiver or the form. It's to say the need is there, but let's try to keep my patient at home in the community, even if that's living with somebody else, because that's where they want to be, and likely best served. So, like the OBRA waiver, it's the State Office of Long-Term Living that's responsible for the oversight, implementation, the rules, changes made to the waiver itself. It all lies with the State Office of Long-Term Living. But the waivers themselves are managed by managed care plans. Managed care plans that bid to be responsible for managing individuals in the CHC waiver and won the bid. Those bids are not indefinite. The state is in the process now of reprocuring. So there could be a change in plans depending on what plans in and out of Pennsylvania, bid to be a part of the CHC waiver. Currently, the three CHC managed care plans are AmeriHealth Caritas / Keystone. They call themselves something different in the 5 Southeast counties. They go by Keystone. The rest of the state, they call themselves AmeriHealth Caritas, Pennsylvania Health and Wellness, and UPMC Community Health Choices. And people have a choice of, once approved for and enrolled in the CHC waiver, then, before they even are approved, they've been asked about, and explained their choice of plan, asked to consider, which plan and what considerations you might want to have, and then choose the plan so that as soon as they're determined eligible, they get enrolled, and then the work picks up there from, one of the 3 plans that the individual chose. And people have a right to change their plan at any point once they're enrolled in CHC. Again, like the other 5 waivers, a whole range of services covered under the CHC waiver, above and beyond what Medicaid insurance covers, just, true as with all the waivers. As I said earlier, anybody, even if they didn't have Medicaid and weren't eligible prior to being enrolled in any of the state's waiver programs, once enrolled, they also then have, Medicaid insurance. So above and beyond, all of the services covered by Medicaid, then people in the CHC waiver also have access to a whole range of services. And again, this isn't an exclusive list. The CHC waiver is also responsible for nursing home services. So hopefully with the incentive to provide people the level of supports they need at home so they don't go into a nursing home. Because if they do go into a nursing home, then that CHC managed care plan, whichever one that person's enrolled in, is then responsible to pay for the nursing home level of care. Almost always more expensive than the in-home care. And so the program was deliberately designed that way so that, it's meant to provide services for people in the home and allow them to live at home and in the community where they generally want to be. But I think also an incentive for those managed care plans, because if people don't get the range of services they need and enough of the services, things like the personal assistant services that people can literally get 168 hours a week of those hands-on, queuing, etc., personal assistant services, so that to keep people out of a nursing home. But if they end up, and sometimes people may be in a nursing home for a short period, hospital stay, may need some nursing home rehab after, that's all falls to the responsibility of the CHC managed care. People apply for the CHC waiver as they do for the OBRA waiver through the state's independent enrollment services. if the person's not already on Medicaid when they apply for the CHC waiver, one of the first things the IEB, Independent Enrollment Services, is independent enrollment broker, is going to ask the person who's calling, to apply, or somebody on their behalf, do you already have Medicaid insurance? If not, one of the first things that will happen is getting either on paper or electronically the application for Medicaid, and that completed application back to Maximus. An important first step in that application process. Again, there's a face-to-face meeting with a representative from Maximus, going to explain the CHC waiver in more detail, talk about the 3 managed care plans, how people have a choice, how they ideally want to make that choice before they get enrolled, if in fact they're determined eligible. And then this waiver also includes that same physician certification form, doctor needing to indicate NFCE, and then that face-to-face assessment also, using the same tool as over the FED, the functional eligibility determination tool, that needs to determine the person is, nursing facility clinically eligible versus nursing facility ineligible. If they're determined nursing facility ineligible, that means based on the assessment and the assessment tool, that they're not eligible. And again, people always have appeal rights. That in-person assessment is done by an entity in the state called Aging Well. Generally, the person from Aging Well works for the county area agency on aging, who will come out to do that face-to-face assessment. So I touched on this earlier. For people in the OBRA waiver from age 18 to 21, prior to 21, there will be a new FED done. There'll be a new physician certification done. If both the FED and the physician certification align, indicating the person is nursing facility clinically eligible, then they are going to transition from the OBRA waiver to the CHC waiver. And there is guidance on how that transition is to occur. Also a good time for people to call us at the Health Law Project if they're approaching that transition or they're in the midst of that transition and it's not happening the way it's supposed to, because it's to be as seamless as possible, so that whatever services and support somebody is getting under the OBRA waiver, continue into the CHC waiver. And individuals do not have a choice between the two waivers once they're 21. If they're determined nursing facility clinically eligible, which is considered a higher level of care needed, then even if unfortunately things have been going great with the OBRA waiver and they don't want to move to CHC, that's unfortunately still going to happen. So many times I've talked today about clinical eligibility, went through the different sets of criteria for the given waivers, and referenced many times people also have to be income and resource eligible for the waiver. And the income and resource limits are the same across all waivers. No distinction there. Currently, 2024 income limits for the waiver: gross income of $2,829 a month. In the case of somebody who is married, only the income of the applicant is counted. So it does not matter what the spouse's income is, just the income of the applicant. That's not true with the resource limit. Resource limit for all of the waivers is $8,000. Resources generally counted are certainly, money in the bank, cash on hand, checking, savings, investment accounts, retirement accounts, any money that people can access, even if accessing it would mean I'd have a penalty. Unfortunately, that resource still counts. It counts minus the penalty, but it counts in that $8,000 resource limit. some of the things not included in the resource limit, the home where the applicant lives. So if you own a home and you live in it or have a mortgage on it, either way, it's your home. That does not count. It does not matter the value of the home. If you have other property that you own, a home, land, those that you're not living in, those do count. And the value of them, the assessed value of them are counted towards your resources. Individual can have a car, doesn't matter the value, it's disregarded for resource purposes for the waiver. If somebody has a prepaid burial account or prepaid funeral expenses, as long as they're prepaid and that money now sits with a bank or with the funeral home, that's not counted in the resource limit. And then income only counted for the applicant. However, resources look at both applicant's resources and the spouse's resources. And there are some limits, some exclusions for married applicants. It's actually a pretty complicated scenario in trying to determine whether an individual who's married is resource eligible, unless, of course, the combined resources are less than $8,000, then they're resource eligible. Beyond that, it's actually kind of a complicated formula used to determine, what resources can be, disregarded and still have somebody meet the $8,000 resource limit for all of the waiver programs. Just some waiver eligibility challenges. I think we've probably touched on, all, if not all of these. There's 6 waivers. Some may be very obviously not appropriate for a given individual. There's no autism diagnosis, then and you're not 21 and older, then that's not the waiver that you're exploring for yourself or somebody else. No physical disability, then likely it's not the CHC waiver. But each of these waivers with their own clinical eligibility, each with some varying application processes and who you contact and who helps you navigate the application process. Hopefully a little clearer after 2 hours this morning, but certainly not a nice, neat, easy system for anybody to navigate. As we talked about, age requirements vary from waiver to waiver. The 3 ID waivers and the adult autism waiver, so 4 of the 6 Pennsylvania waivers have waiting lists and long waiting lists. There is not a waiting list for OBRA or CHC, but you have to be 21 for CHC and 18 for OBRA. And then, of course, meet the other clinical criteria and the financial eligibility. And then, as some people already even, asked about, sometimes, deciding which waiver best meets an individual's needs, can be confusing. Sometimes it's not confusing. It maybe is clear. I have some clients now on the CHC waiver that I and they feel confident would be ultimately better served in one of the 3 ID waivers, likely the Consolidated Waiver. The challenge, of course, is the waiting list. And so in the meantime, they've got a waiver, they have services that are helping and meeting some needs, but not the ideal waiver. And they can be on that, certainly the waiting list for any of the ID waivers, but very challenging to get into an ID waiver when you're already in the OBRA waiver or the CHC waiver or the autism waiver. Folks have more questions about waiver eligibility, about waiver application process. For any of these 6 waivers, that we are certainly a resource. We only really specialize, if that's the right word, with eligibility denials for the CHC waiver and the OBRA waiver. And quite honestly, that's largely because the other 4 waivers have, long waiting lists. And we don't have, the expertise, or current funding, to help people and really just advocate for them. Unfortunately, those 4 waivers are not, an entitlement. They're not entitlement waivers like CHC and OBRA are. So we are not really able to provide a whole lot of assistance to people waiting to get one of the ID waivers or the autism waiver. And we don't assist people with any denials of services through those waivers. We do assist people with eligibility, and denials of eligibility for the CHC OBRA waiver, and assist people with denials of services through the CHC and OBRA waiver. And again, folks have our helpline number Monday and Wednesday, 8 a.m. Earlier you call, the better. And you have my direct line and my email for, any follow-up questions now or down the road.
So a couple of, just generally, Janice, because we had a couple of questions again about financial eligibility, like for example, income guidelines to pay for the supplement for Medicare. And then of course, there's some additional questions, just financial eligibility. On the Pennsylvania, the health law website, you can get information on those income guidelines, can you not? Isn't there?
Yes. Yes. But some of what can be tricky is depending on what program we're talking about. Waivers not so tricky because the rules are all consistent. For income, the waiver looks at gross monthly income of the applicant only, with 0 disregards. None of their income, no portion of their income is not included in looking at their income eligibility. For other programs like the state paying for somebody's Medicare Part B, as in boy premium, income is counted differently based on the source of the income. And of course, some people have more than one source of income. Somebody could be on Social Security, disability, or Social Security retirement, for example, but also maybe be working. And so there's different rules for how that income gets counted. So even if you go on our website and see 2024 income limits for a variety of Medicaid categories, it's still worth reaching out to us, because it, again, depending on the category, depending on whether or not it's waiver you're applying for or something else, there can be disregards to a person's waiver. I'm sorry, their income.
Yeah.
And in other cases, there is not. So,
Okay.
yeah, it's.
So they should contact you, it sounds like, if they have a question on eligibility.
Yes, especially on the financial eligibility piece, because again, these programs are all so complicated, that it's in a nutshell why we exist at the Health Law Project.
Right. And it sounds like a number of questions were asked about the waivers that cover the day programs, because again, community health choices, the autism waiver, I think someone asked about, and OBRA waivers do not cover the day program, CPS services. Can you confirm that? I think that's the case. It's only the ID waivers, correct?
Yeah, CPS, I'm not clear what CPS is.
Community program services. They're the day supports, where people go to day programs, I believe.
Yeah, the CHC waiver absolutely does cover adult day services.
Okay.
But again, I think this is where it can get really, as it should be, specific to the individual person's needs. But, it could be that somebody in the CHC waiver maybe with, in addition to some physical disabilities, has autism or ID. The entities, the providers that provide adult, day services through the CHC waiver tend to be more focused on, a population that doesn't also have autism or intellectual disability. So, some of it is just, about finding out about the programs, even, getting into the programs. If you're in the CHC waiver and maybe on the sadly long waiting list for an ID waiver, there are adult day services. So you want to check with, your CHC managed care plan. Who are those providers you're contracted with? Where are them? Where are they? And finding out more about, the services that occur in that day program and the given population there, so that, might it be a good fit for, myself or somebody I'm helping to explore this with.
And is there a cap on the CHC waiver?
There is not.
Okay.
But keep in mind, the CHC waiver is a managed care waiver. Anybody working for a managed care plan may not agree or appreciate, but managed care is managed dollars.
And
so
someone
reality
asked,
is, people can, there are a whole plethora of services somebody can get through CHC. It doesn't mean they're all going to be approved. But again, people have appeal rights. And that's one of the areas that we can try to assist people with.
and someone did ask if somebody receiving OBRA or CHC can live in a group home.
No for CHC, and I'm not sure for OBRA. I think, I should know that, but I don't. I think no. The person who asked that question, please email me.
All right. Let's see what's the current size of the waiting list for the adult autism waiver? Someone asked.
I don't interest list, just what they call it, same thing. I don't think I found that information. Yeah, I don't know. And again, certainly anybody who knows or has a sense of it, please put that in the chat. Yeah, I don't know how long the current interest list is.
Let's see, someone did ask about autism spectrum disorder qualifying as a DD for OBRA. Oh, I think they say DD for OBRA. I guess the question is does ASD qualify as a DD for OBRA? So autism spectrum disorder.
Yes. Again, keeping in mind that, it isn't, because autism is seen as a developmental disability. But keeping in mind that, like all of these waivers, even though, it's the, it isn't just the diagnosis, it's the, potential functional limitations tied to, that diagnosis. But yes, somebody in the OBRA waiver could have a primary diagnosis of autism, and meet that developmental disability piece of the criteria.
Right. Okay, I'm just kind of going through to see if somebody asked, once you have the ID waiver, what do you have to do to keep it?
Don't move out of state and continue to, access the services. If you have the waiver, and I think I would imagine it's infrequently the case, but if you have the waiver, one of those three ID waivers, the whole point of getting into the waiver is because there are a few or many services that you want and need to support you. So make sure you're accessing those services. Otherwise, that could present a challenge. And I think that's true of all 6 waivers.
And someone clarified CPS, community participation supports. Thank you. And we had a bunch of questions that related to ABLE accounts and if they are counted in the resource limit. And I did type back that indeed they are not counted. They are excluded just as, yes, they are excluded as being counted as resources for waiver eligibility. So I just wanted to confirm that with you, Janice. And no,
Yeah, and yes, we don't actually have expertise in the PAA account, but yes, absolutely, that's correct. And really, one of the reasons PA adopted and created the PA ABLE account, so that people could still be able to protect some resources without, losing access to really important benefits and services.
there's still a number, it's 12:07. There's still a number of other questions. I don't know how long you have, Janice, to.
Yeah, I do have more time, and
Okay.
certainly I'm sure people who maybe already had a signed off.
Yeah.
I do still have some time. Absolutely.
Okay, then someone asked for if CHC waiver allows for special services such as music therapy.
I don't think music therapy is generally a covered service under CHC. Yeah, it's not. I wrote a book with CHC participants on this, and it's on our website. Yeah, no, music therapy is not covered generally under CHC, and I say generally because people can get their services with the CHC waiver under a program that's called Services My Way. And Services My Way does allow some flexibility, and people are basically managing their budget. And in that case, the budget is kind of tied to what services they need. But under Services My Way, somebody could use their CHC waiver budget to access something like music therapy. And it would need, it would be in their service plan. It would be tied to a goal in what's called the person-centered service plan and the CHC waiver. So that's really the only way somebody could get music therapy covered with the CHC waiver.
And someone asked if there's a list of providers for the CHC.
There is, but it would be specific to each CHC managed care plan. So you would have to actually go on the website of one or each of the 3 CHC managed care plans, to, and kind of plug in, employment job coaching service or, personal assistant services. And then that it would pull up a list of providers. That, of course, is always contingent on that provider list being current and updated.
Okay. And someone did ask if they're a provider of service, speech therapy, how can they become an approved provider for waiver, such as person and family directed? What the application process? What's the application?
Yeah, I think, and not something we have real expertise in or assist providers with, because our focus, of course, is assisting, participants. I think it depends on the waiver. In the case of the CHC waiver, the provider needs to contact each of, or start with one of the CHC managed care plans, and find out who are the provider contacts, and they would first need to be a Medicaid enrolled provider. But a CHC plan, the provider, folks that work on the provider side in each of the CHC plans, would be able to walk people through that. And like most contracts, and that's what it would be as a contract, both parties have to be willing and in agreement. So I know we hear anecdotally from providers who are trying to get into, one or more of the CHC managed care plans, and the CHC plans are, basically saying we have all the providers we need to meet our needs, and they don't accept them in the plan.
And someone just did post from ODP provider pages on qualifications. So perhaps Patty can type that in the chat. So that's available as a link. Thank you. Someone mentioned or asked about, she's saying that I heard Janice mention the person-centered plan, service plan. And if the goals are on there, my service coordinator doesn't ask me about my goals. So how can I make sure that I am able to achieve my goals with the CHC waiver? Thanks.
Yeah, great question. And one that quite honestly is very problematic to hear now that we're in 18, 19, in a year 6, is it 7 of the CHC waiver? Yeah, I mean, people should have developed their person-centered service plan. I can assure you, fairly certain, that you have one. If you didn't help develop it, if you don't know what goals are in it, what services are in there that you're approved for, that's extremely problematic. And I'd encourage people to file a complaint with both their CHC plan and directly to the State Office of Long-Term Living. We see these things happen. We report them. We work very closely with the Office of Long-Term Living in trying to help, improve the CHC program. So yeah, you'd want to contact your service coordinator. If you don't have a copy of your person-centered service plan and don't know what's, in it, and perhaps don't even know all the services that are a part of the CHC waiver, you of course have every right to know that. And there you will find on our website, phlp.org, click on resources, click down on the left side where it's, says home and community based. And then it will pull up some of our documents, including a guide that we wrote on person-centered service planning that talks about how it's supposed to be just that, person-centered, you, the person on the participant in the CHC waiver. It lists in the back of it all the services available under CHC and a brief definition, and lets people know that. And that should be a living, breathing document, because of course our wants and needs change.
Good. So someone else asks if they have a client that was deemed ineligible for Medicaid due to having too much money in the bank and not submitting required paperwork. Is that a scenario where they should contact the law project?
Yep, absolutely.
Okay, so you can potentially help that person depending on the situation.
Exactly. At the very worst case scenario, we're going to tell them you're not eligible and explain to them why.
Right.
Otherwise, yes, absolutely. Then help them get on or back on Medicaid.
Okay. And somebody asks, are there barriers for people applying for CHC with felony records?
No.
Okay.
No.
Person can apply. No issue. And OBRA deals with individuals who are in a nursing home, from what I've experienced in the past. It's just a comment that someone in a nursing home that was receiving OBRA services.
Yeah, I mean, that's certainly, that's certainly possible. And unless that was that person's choice to, be in or stay in or live in a nursing home, that's not how it's supposed to work.
Right. Okay. Let's see. Is there a place to see all the services offered by the CHC waiver?
Yes. And actually the guide that I just pointed to, the person-centered service planning guide that we created, the Health Law Project, with participants in the CHC waiver, that's on our website. And otherwise you would, the list, I believe, is right on DHS's website, like Googling. And I apologize, I should have had more of those links on my slides. I think if you just Google community health choices, waiver, one of the things that pops up should be the DHS website, that then lists all those services. And then, as I said, and there'll be a link to the current CHC waiver. I think the current one is still 2023 waiver, because amendments get made to the waiver every year. Again, that's about a 500 page document, but there is a section that lists all the services, and then other sections that are more detailed about just what is that service, who's the provider that can provide that service, what can that service provide and not provide, definition of the service.
Okay. Let's see what else we have here. Community living waiver. Somebody asks if the community living waiver, I assume that's the ID waiver, can funds be used for admissions or memberships such as museums?
Yeah, I don't know. And largely because we don't do the work on the ID waiver side.
So it'd probably be something to ask the supports coordinator, I assume.
Yes, or again, certainly if there's somebody, somebody listening in who knows the answer to that, please put it in the chat, and thank you.
Let's see. And again, someone asked about not waiver related, but regarding Medicaid, is there an age that my high functioning autistic son would lose his Medicaid?
In order for anybody to have Medicaid, they have to meet a category of eligibility, and then they have to meet the income guidelines for that category. And there are also some categories that have both income and resource guidelines. It's very individualized. And depending on the age of the individual, it also can be tied to things like, because some categories, the income eligibility is tied to the person's tax filing status. Are they a tax filer? Are they a tax dependent of somebody else? Are they neither? But not all categories of Medicaid look at that. So unfortunately not a clear-cut answer. But certainly call or email me if you want to. The more details that I have, the much better help I can be.
Someone did comment the community living waiver cannot be used for memberships. Thank you for that answer.
Yeah, that's a disappointing response.
Let's see. Someone says this is from your website. I assume the law project is this what you meant by a day program for the CHC program? Because it does not sound like the same type of day program CPS that is covered by the ID waivers. Adult day living services, community-based center providing at minimum personal care, social, nutritional, therapeutic services. These services are generally provided at least 4 hours a day for at least 1 day a week. These are basic and advanced adult daily living services. Advanced daily or have additional requirements regarding nursing, increased staff, physical, occupational, and speech therapy, and medical services. Is this what?
Yes. I mean, when I said that there are, when the earlier question, perhaps same person asked about, or thought there was no day services available through the CHC waiver, there are, and it's the adult daily living services that they are referencing. So again, yes, it certainly could be, the providers within the 3 CHC managed care plans, that provide the adult daily living services, may or may not be what somebody's looking for or wants and needs. They're assisting people who need the assistance while they're with bathing, with dressing, with toileting, providing activities. They are, depending on what time of the day they're there, they're providing them meals. They're assisting people who have mobility issues with mobility. It's providing obviously a social interactive environment, but they're not doing things like job readiness there that might happen in a different setting under a different waiver, likely not going out into the community beyond the day center that is in the community.
Okay. So And again, she's saying, thank you for clarifying. It doesn't seem like CHC provides the type of day program I'm referring to. So
It very well may not. But, and again, the challenges that, can be that, if the day programs are more, within the ID waivers or the autism waiver, unfortunately, the difference between them is somebody can, if they're clinically eligible, get into the CHC waiver, whereas they could potentially be waiting any amount of months or years to get those
Right.
programming through the ID waiver. The governor's proposed some significant dollars to work on that waiting list. I also share that with people generally, which is why I say I'm often not invited to parties. Nobody wants to hear about, do you know how many people in this state are not getting what they need? But really, generally, I think it's helpful when people, just everyday people, family, friends, neighbors, know about those things, because it's hard to care about stuff you don't know about. And when you know about it, then you may care and you may write to your legislator.
We really appreciate you taking the time to join us. And we do have some upcoming events in April. We're doing one on the basics of social SSI and SSDI with Elaine Cole. So please, you can find registration information on our website for that. And I did just want to mention 2 other programs that we have coming up. If there are any attorneys in the audience and you're still online, we have a CLE event coming up on June 5th. And then in October, not on October 9th, we're going to have our 4th annual future planning conference. So this information can all be found on our website, in our newsletter. And if any of you have any questions on these programs, here's my contact information as well. So again, thank you all for sticking around so long. And Janice, thank you so much for your time.
Sure, Patty. And a plug for obviously all of your webinars, but for, folks who maybe or have kids that are, getting close to age 18. I mean, the email with, the workshop with Elaine Cole is valuable, period. But things really can change both on the Social Security side and the Medicaid side when, kids are turning 18, especially kids, of course, with disabilities or significant health issues. So really valuable information that Elaine has.
Thank you so much. Thank you all. Have a good afternoon.
Thanks, you too. Thanks, everyone.